Hey everyone, Justin Holland here with the Mad Insurance Show, making a difference in insurance. Got another great show for you. I got a handful of topics. I'm going to probably be all over the place today on today's show, but bear with me and so glad you can tune in. You might be watching us online, or you could be listening to us on the radio here on KTSA 550, scooting around San Antonio. On our online, if you're catching this show, or want to watch this later and say, hey, I'm only going to get a little bit of the show from Justin, you can go to youtube.com/ at Mad Insurance Show. And you can take a look at all the videos, all the content we putting out there regarding everything insurance. So let's dive into what the Mad Insurance Show is all about, making a difference in insurance. I created this show to basically talk about all types of insurance situations, news, articles, things that people need to keep in mind. And that could be talking about Medicare plans for seniors, which is an absolute dumpster fire right now, the Affordable Care Act on how those costs of individual health insurance is rising. We have solutions and alternatives to that, by the way. Could be employee benefits. You might have a small business or a large business, and you just need some consulting or need some ideas on how to maybe correct some issues you've got there on your employee benefit strategy. We talk about that on the show. And then also we talk about life insurance, long-term care insurance, social security analysis as it relates to retirement, as well as auto, home, commercial lines of business, umbrella. All of that is dialed in to the show, and we have all types of topics that we discuss. I've usually got a guest on the show. I'm a solo host today, but I will tell you we got some great nonprofits joining us. We have some congressional candidates joining us on future shows as well to talk about specifically Social Security, Medicare, the Affordable Care Act, affordable health insurance and care out there. These are big pressing issues that our legislatures, our future legislatures, need to act on for us, their constituents. And I'm real excited about what we'll be bringing you guys over the next few weeks with that. Let's give you a little bit of detail on me. So my name's Justin Holland again. I've got two agencies here in San Antonio. One is Texas State Insurance Services, where we focus on individual health, the Medicare, employee benefits, all that stuff that I was talking about a minute ago. Texas State Insurance Services focuses on that. If you need help with your individual health, group health, Medicare, anything that relates to that, or just have some questions for us, give us a call at 210-880-5316, or you can visit us online at txstateinsurance.com, fill our contact form, and we'll have Lydia or Erica give you a call back and schedule a time for us to visit. And most of the time, you're going to talk to me. And I've got a great staff that helps us block and tackle everything for you on what you might need to get things quoted, analyze options. Let us know. We would love to help you out. And again, that number is 210-880-5316 for Texas State Insurance Services. Our other agency that we've created is basically going to help you out with auto, home, life insurance, long-term care, social security analysis as it relates to your retirement. Give us a call at Palmetto Life Group. That's 877-357-5316, or you can visit us at palmettolifegroup.com. That agency really focuses on that dynamic of the industry. And what's nice is we're able to help you across the board, on all aspects of insurance. And I think that helps separate us from other agent brokers on what I'm trying to do here for the San Antonio listening audience, as well as all of South Texas. We can service and have channel partnerships all over the country. So if you happen to be catching this online, let us know. We can tee you up with somebody out of the state of Texas or out of South Texas that can possibly help you out. I'm confident that we can help you do that. So got some housekeeping out of the way there on the show, what we're doing, what it's about. Let's start diving into some articles. I've got some stuff that I want to visit with you, specifically on the Medicare side. We'll talk about some individual health insurance options that I have been helping out quite a few families with recently. But I love talking about the news articles that we find. And the first article that I want to dive into is a big one, and I think this is going to resonate in health insurance costs because they're through the roof. They're really hurting people right now, and we're in a dangerous situation, I think, with the cost of insurance or healthcare in general. So this article I came across, it was a political article in the statenews.com. Let's see when this article was drafted. June 23rd. So a few days ago from me recording this show that airs on Saturday evenings. Washington, the Justice Department on Tuesday announced criminal charges against 455 people as part of a 2-week healthcare fraud crackdown that officials say solved more than 6.5 billion in false claims submitted to insurers. Okay, that is a big headline. Actually, that was the basically the first paragraph on it. The headline is Justice Department announces hundreds of charges and multi-billion-dollar healthcare fraud crackdown. This fraud is what's been causing a lot of health insurance costs and healthcare costs to skyrocket. And I will tell you, I don't agree with some of the stuff that the way they're handling it as far as health insurance in that industry right now, because I'm in it. I'm entrenched in that with my clients and growing our agency. But this is a good start to help curb the fraud that's going on out there. And the gloves are off, man. They're coming out swinging with the Justice Department off of this. I'll go dive a little bit more into this article. Among those charged is a nurse practitioner accused in Texas of billing Medicaid for medically necessary wound care procedures and using the proceeds for fancy jewelry and luxury cars. A mental health company owner who prosecutors say exploited the homeless by billing for crisis stabilization services they did not need, and a hospice owner alleged to have had paid kickbacks to a funeral home employee for information about Medicare beneficiaries. Um, I don't know how sophisticated this fraud was, but it was under the radar. It's probably been under the radar for years, and they're coming after it. And I'm hoping that them cracking down on this will help bring and lower the cost of healthcare for all Americans. Okay, because I mean we are struggling right now. Everybody is on the cost of their health insurance and healthcare costs, and this is big news. Let's dive into a little bit more. Another person that was charged, a heart doctor, is charged in Florida in a $89 million healthcare fraud scheme, accused of billing insurers for medically unnecessary cardiovascular screening tests for college student athletes, and then rubber stamping the results as normal without reviewing them. Okay. Um, $89 million, a part of that doctor's that was charged off of that. Another one, a 53-year-old faces charges in Florida, again in Florida, healthcare fraud and conspiracy that prosecutors that describe as a years long scheme that preyed on fears of athletes and they could die playing fields on courts with sudden cardiac arrest. Um, Man, I'm excited that they're doing this. Healthcare fraud has been a long running Justice Department priority, and they've possibly been laxed over the years. Well, they're coming out and they're enforcing this, and I'm hoping that with what they're doing today on this will resonate and help. Now, it's kind of rearranging the deck chairs on top of the Titanic, so to speak, in our industry of healthcare and health insurance. But hopefully, this will be the just one solution that's help going to drive those costs down. I mean, this is big news, and I just don't think a lot of people are talking about it. You might have seen the headlines online about this. Um, it looks like I'll dig in a little bit more on this. The alleged fraud for one of these ran between 2019 and the end of last year, end of 2025. And prosecutors say involved in pair of unidentified co-conspirators at a Florida-based cardiovascular testing facility and treatment practice that was owned and operated. So, this isn't. They've got people that they're taking down, but make no mistake, there's probably plenty of others that are aligned with that hopefully will be taken down as well. Because if you think about it, if the main people don't get caught, they're just going to open up shop and try to do this again with what they've already done, maybe in a different way. So It'll be interesting how this plays out. Another one here in Texas-based doctor who pleaded not guilty during a court appearance in Florida on Monday did not return messages seeking comment. The jig's up, and this is going to hopefully help. Let's wrap up this article by talking about how insurance companies do not cover blanket cardiovascular testing, which was one of the frauds here going on, but instead require a prior finding of medical necessity. To avert that roadblock and secure reimbursement, prosecutors say that the person that was arrested submitted to insurance phony diagnosis of conditions. So the insurance company was receiving, possibly what they thought were credible documents or diagnosis of conditions, and basically they're saying, hey, they'd show elevated blood pressure and hypertension that these athletes or these patients didn't actually have. Okay, so very broad takedown of the fraud that's going on in the individual health insurance. I'm sure this is affecting group insurance benefits as well as the Medicare plans for seniors out there. So, man, kudos to the Department of Justice. They're coming out swinging, and they're trying to take this on and try to get some of these backed actors. Actually, let me wrap up with this. This is a comment for Mahet Oz that runs CMS over there. There's no way they could miss that except they didn't care. A cardiopathic surgeon by training and head of Centers of Medicare and Medicaid Services. This is not a diagnostic company. It's a predatory scheme dressed up in medical clothing, and we're going to treat it as such. So they're taking this seriously. Let's see how that plays out and helps. So great article on that regarding what's going on with the fraud crackdown in healthcare and as it relates to health insurance. That's just our entry level topic that we're talking about on today's show. Just as a reminder, everybody, you're listening to the Mad Insurance Show, making a difference in insurance. I'm your host, Justin Holland. Got multiple agencies here in town that help out with your insurance needs. And the show is basically here to just talk about everything insurance. We just talked about the fraud that's going on and getting cracked down on in healthcare and health insurance. Let's talk about another article that I came across. This was with the Kaiser Foundation. This was updated on June 16th, so a week or two ago. And I love taking a look at what the Kaiser Foundation brings to the table online. Um, I've depended on them for as a valuable resource ever since I got into this industry and got licensed, and that was back in 2012. So we're closing in on 20 years in the industry and business, which I'm excited about. But this Kaiser Family Foundation article was published June 16th of this month. The authors were Jennifer Tolbert, Sammy Cervantes, Clea Bell, and Anthea D'Amico. I think I'm saying that right. And basically, they introduce things on this article and kick things off on the high cost of private insurance and the limited availability of public coverage for some individuals with low income. And I got a lot to say about that I'll comment on here in a minute, particularly in states that have not expanded Medicaid under the Affordable Care Act, the ACA. It's continued to leave millions of people without health coverage in 2024. I would say it's led for a lot of people not having coverage sooner than that. In all honesty, the fragmented complex health insurance system also means that some people are falling through the cracks. Absolutely agree with that. They're falling through the cracks with coverage. They experience a change in circumstances. The end of conscientious enrollment in Medicaid also affected health coverage trends in 2024, starting in April of 2023. Again, this was post COVID. A lot of chickens were coming home to roost after that in the health insurance industry after the pandemic. But what had happened was there was something called the Medicaid unwinding. There was a period where during the pandemic, this is interesting if you don't know this already, individuals were getting approved for Medicaid. Okay. Some of those might not have typically gotten approved, or maybe they got approved initially. Well, during the pandemic, they were just automatically renewing those Medicaid enrollments. So all that cost was ramping up. These people were getting their health care through Medicaid, and that was nationwide. They finally tried to scale that back. It was called the Medicaid unwinding. We tried to do a big push and awareness on that here locally for that. And all states that had completed renewals to verify eligibility for the program for all enrollees was going to end at the end of 2024, leading to the disenrollment of millions on Medicaid enrollees. Most individuals losing Medicaid do not have access to affordable job based coverage. And while many transition to subsidized coverage through the marketplace, even with the enhanced marketplace subsidies that they had at the time, are still in place in 2024, the coverage was unaffordable for some. These coverage transitions loss contributed to the first increase in uninsured rates since 2019, right before the pandemic. Um, let's talk about this. There's a lot to unpack on the introduction of this article with the Kaiser Foundation. Um, the Medicaid unwinding that took place a few years ago caught a lot of people by surprise. I can't tell you how many phone calls we received at our office of people like, "Hey, I lost my Medicaid. I found out when I went to the doctor's office, they said I didn't have coverage. I need your help to get into health insurance." Well, this was a whole nother administration at the time in office, and they were more lax on making sure, hey, let's bridge the gap and allow these individuals a special enrollment period if they lost their Medicaid. A lot of people just disregarded that and waited till after the special enrollment period to reach out to us, or I'm sure other agents and brokers around the country, and it was too late. And you're left without health insurance, and you had to basically wait till the annual enrollment period to possibly get in. Let's dive in to some cliffs that are important to notate on the Affordable Care Act. Um, you have to make an income to qualify for Affordable Care Act subsidized coverage. Okay. And if you make too less, you don't qualify. If you make too much money, you don't qualify. So you've got a cliff of not making enough money. Um, and you've got a cliff that you don't, if you make too much money, you're not going to qualify. What happens is you've got a lot of people that are basically, not at a federal poverty level within the scale of that income that are going to qualify for health insurance. Okay. So let's just say it's a little over $16,000 for just one person. If you make $15,000, you're not going to qualify for a zero or low cost premium. You're not. Okay. So you're expecting somebody at an income of $15,000, which I have many people that call into us for help on this, that aren't going to qualify for a subsidized plan coverage because they're not going to qualify for Medicaid because Medicaid wasn't expanded in Texas. And it's like that for many other states as well. And I understand, why they do that, but I see a lot of people that need health insurance and they're sick. And the only way they can get it if they're a child, in a low income family, they are a pregnant woman or an elderly adult, and you meet the income criteria for that. If you don't, a lot of people are expected to spend $600, $800 a month for health insurance that they just can't afford. Okay. Depending on their age, that cost is higher or lower, depending on the age. But there's cliffs with that. So if you don't make enough money, you're not going to qualify for affordable health insurance. Now, when you get into that above that lower income bound, middle class, upper income, bands, let's talk about 62,000 plus up to 128,000. Depending on your family size, that's going to be your limitations there. Okay. We had individuals when they expanded subsidies for the middle class, that opened up affordable insurance for those families that were making that 60,000 to maybe a couple $100,000 and giving them affordable options to where they went from what would typically be a 2,500 or maybe even a $4,000 a month premium for their family down to, 500 or under $1,000. Okay. To where they're got something reasonable. Still think that's high, but that's just where we're at in the industry. There's a lot to unpack in this article, And, that Medicaid unwinding was big. And ultimately, what the Kaiser Foundation is trying to bring to light is the number of people who are uninsured and expected to continue, and that's expected to continue and increase in the coming years because of the changes to Medicaid and the Affordable Care Act included in the 2025 reconciliation law. Basically, it was the expiration of the marketplace enhanced subsidies and tax credits and other administration actions that had basically gone into that update. Um, but man, was it a tough fall because basically that's the time of year, November, December, October, January, going into the next year is when you have the opportunity to maybe to either switch your individual health insurance with the marketplace or to get on it. Maybe you missed the opportunity for a special enrollment and you're waiting for that to open up. And the biggest thing, and man, I've talked about this on the show a lot, was the fact that we had middle income families, middle class, upper middle class that were qualifying for affordable insurance premiums or insurance premiums they could make work, and just got absolutely destroyed with the premiums. And a handful of those families said, "Hey, Justin, you know what? We have to have this health insurance for my child, for a spouse. We'll just figure it out." And they're just trugging along, trying to make it work financially. And a lot of those, and I mean, every week I've got a client that calls in and says, "Justin, I can't do this anymore. What other options do you got?" Well, I've got some options that we can consider if they're healthy. If they're not healthy, the Affordable Care Act, where there's no underwriting restrictions, is going to be the way to go. And then it's got to be, then it could come down to, okay, you know what? Instead of insuring the whole family with health insurance, um, we're just going to have a spouse and one of the children covered. Okay. That's not right. That's not good. And it's not fair. A lot of people are great. These are great families and individuals and business owners and contribute to society in most of the cases. And some of them don't have that opportunity to contribute to society. They need some help, and we are sounding that alarm bell, on what's coming. And I think it's going to get worse. I think we need to prepare. You need to reach out to us at Texas State Insurance Services and say, "Hey, Justin, I heard you yapping on the radio or on the talk show online, and this is what we're dealing with. Let's take a look at solutions and options." I will tell you, a lot of people are pleasantly surprised. I'll try to go over some case studies here when we wrap up the show, specifically Medicare scenarios or individual health insurance scenarios on what we were able to do for people. And I hope that resonates because this is going to get tougher and tougher. I'll probably have some more updates from the Kaiser Foundation in the coming weeks. The key takeaways from this article that I wanted to bring up online, how many people are uninsured? For the first time since 2019, the number of people without health insurance and the uninsured rate increased in 2024. Again, we're looking at numbers from 2 years ago. They've gotten much worse since then. These are the stats that they're able to process and kind of digest for this report. The total number of people ages 0 to 64 without health coverage increased by more than 1.3 million, that to an elevated number of 26.7 million in 2024. Okay. The uninsured rate for population under 65 increased from 9.5% to 9.8%. A decline in Medicaid coverage drove the increase on the uninsured. A lot of people just missed the opportunity to get on maybe their employer sponsored insurance plan. It could have been unaffordable for them, or just didn't think to go to a marketplace plan that you could line up and get dialed in. Who are these uninsureds that they are basically looking at from 2024? Over 8 in 10 people who are uninsured with low income families, that's 80%, 80.1%, had at least one worker in the family, 85%, 85.1%, and over 6 in 10 were people of color. Okay, so they're looking at that demographic. Bottom line is everybody's getting hurt on this. I will tell you. Reflecting on more availability of public coverage in some states could help. But again, if you don't know already, Medicaid and the government, CMS. It's basically a state and federal system. Okay, they connect. So the state can make one thing happen, and the federal government can make another thing happen. But the states, I believe, in most states, they make the call on expanding Medicaid for individuals. If you know somebody that lost their Medicaid or lost their group and sponsored health insurance plan or any health insurance that they've got, reach out to us. We would love to see if there's some solutions to bridge that gap. And a lot of times it is time sensitive to have that done or it make that transition work. But a lot of people are losing health insurance. I'm getting more calls than ever of people getting laid off, losing their jobs. I hate to see this, but a lot of them still need to continue with their health insurance. And we've got affordable health insurance options that maybe counter those where people just don't qualify for those Affordable Care Act subsidies. The high cost of insurance is the main reason for these people staying uninsured, obviously. They're just not able to afford those premiums from their employer if their employer is offering a plan. So that's where we've got to come in and offer some solutions. As a reminder, everybody, you're listening to the Mad Insurance Show, making a difference in insurance. I'm your host, Justin Holland, with Texas State Insurance Services and Palmetto Life Group. And we talk about everything insurance. I've been diving into a few articles here. One was about all the health insurance and healthcare fraud that's getting cracked down on. And then I've been diving into a Kaiser Foundation article on the serious problems we've got. A lot of people just not qualifying or going uninsured when they need it. This is the time where they need it most right now, when inflation's up and everything else is going crazy in the world. Let's wrap up with the Kaiser Foundation on what are the financial implications of being uninsured. I think this is important to talk about in this article. Uninsured adults are nearly twice as likely as insured adults to have a difficulty paying their healthcare costs. Nearly 6 in 10, 59% of uninsured adults find that they or someone living with them had problems paying for health insurance, compared to 30% of those insured adults. Okay? People are uninsured and also more than likely to make likely to experience measures of financial distress, including overdrawing their checking account, having been contacted by a debt collection agency, and having used payday loans. Okay, I will tell you, I used the payday loan once. Man, we're talking probably 25 years ago, and boy did I learn my lesson on that, on having to pay interest. And you learn. Okay, that's the thing. We're trying to keep individuals from having to make some really tough decisions or go um, above and beyond or to extremities of what they need to have to take care of their health care. Unaffordable medical bills can lead to medical debt, particularly for the uninsured adults. More than 6 in 10, 62% uninsured adults reported having healthcare debt, compared to over 4 in 10 of the 44% insured adults not having to worry about that debt. So I've got some charts here. We'll try to throw it on the video segment that we've got here, if possible. If not, I'll have some links to these articles where I'm pulling up this information. But it basically shows, the graph on. Let's look at 2010. I'll just go over a few numbers here because these are pretty interesting. The number of ages, a number of people ages 0 to 64 who were uninsured from 2010 to 2024 in this chart. Now, in 2010, there was 46.5 million people uninsured, didn't have health insurance nationwide, period, based on those numbers. That started lowering sharply, it looks like in 2014 when the Affordable Care Act started, okay? And then it kind of leveled out. It went down to 35.9 million from the 45 plus, down to 29 to 26 to 27, hovered around 27 to 28 million up until 2019. For some reason, they are not showing a stat, believe it or not, in 2020. I got to figure out that. And then again, it's just been stable at 29 to 26 million, but now it's starting to creep back up. Okay. We could get back to those 46 million people numbers of people being uninsured. And that's scary. to think about. And this is a sobering article off of that. So we'll wrap up with the Kaiser Foundation article there. Um, I mentioned the radio show, or the Mad Insurance Show, making a difference in insurance. I'm your host, Justin Holland. Time for me to plug my agencies here real quickly. Texas State Insurance Services is my agency that handles everything health insurance, Medicare, individual health insurance, small group benefits plans, even large group benefits plans. So if you need us to come in and help you with a consult there, we've got some great channel partnerships that we can help out on that side of the business. Travel insurance as well. A lot of people call us for dental and vision, and we've got some great programs and carriers that we can help you out with that. But the majority of the people that call us are for individual health insurance, Medicare analysis and scenarios there, or their employee benefits. They need a strategy, whether they offer them benefits or not. They're just trying to take care of their valued employees. The phone number for Texas State Insurance Services is 210 880 5316, or you can always visit us online at txstateinsurance.com. My other agency that we have here, and by the way, we have 4 locations. We can visit you in San Antonio and one in McAllen, servicing the Rio Grande Valley area. We can help you out remotely throughout the state as well. So just know that we'll help you out there. But I wanted to plug that we've got 4 locations to visit with you here, San Antonio proper and the surrounding area, as well as the McAllen location. Let's go back to the Palmetto Life Group. Palmetto Life Group, I created that agency for life insurance, long-term care insurance, Social Security analysis as it relates to retirement. I am an RSSA, a registered Social Security analyst. There's only a handful of us in South Texas that have that designation. And of that handful, I think I'm one of the few that really try to market that and help our clients with Social Security analysis. A lot of times you need to talk about that in your late 50s, early 60s, before you turn 62, when that opportunity for Social Security comes up. Because, I mean, you could be leaving hundreds of thousands of dollars on the table, and you want to have a plan for Social Security. It's in trouble right now. So you want to make sure that you have some guidance on that, and we'd love to help you out with that. Reaching out to us at Palmetto Life Group is going to be 877-357-5316, and we'd love to help you out. You know, just give us a call. You can visit us online at palmettolifegroup.com, and we'd love to help you out there. One more time, but before I forget to do it, is if you're listening to the radio, you're just catching a couple clips of the show or just a few minutes, look us up online. Follow us on YouTube at our YouTube channel, youtube.com/at Mad Insurance Show. This show is really focused on you, the general public, potential clients that we could engage or help out, and just give you some value on what you need to know and what's going on in the industry. That's why we're bringing in the nonprofits, to help get the awareness on them. We're trying to bring in industry experts. I'm going to have some legislative candidates come in as well. I've got a few Congress people lined up. I got more to where we can ask them some questions we need to have answers to, or hopefully if they're elected, they can start fixing, over there in DC. I'm going on a tangent, guys. But Texas State Insurance Services, Palmetto Life Group, that is my 2 agencies here. We'd love to help you out with your insurance needs. Just give us a call, look us up online, and just ask for me, Justin. You'll probably talk to Lydia or Erica, one of those 2, and we'll schedule a visit, and I'll see how I can help you out. I'm looking forward to you giving us a call. Another article, Rice Baker Institute article, group health premiums vary 5,000 plus per employees at Texas universities. So that is an article that I want to dive into. Let's pull this up. So this is a Rice University News Media Relations article that I came across. This was actually an article that hit the news outlets back on June 3rd of this month, 2026. Avery Ruxer Franklin is the individual that had this article. Texas universities show sharp differences in health insurance premiums. Baker Institute report finds. Individual coverage costs vary by more than $5,000. Family plans costs span more than $25,000 across Texas higher education institutions. Okay. That's a lot of money. Okay. $5,000, even $25,000. And I will tell you the hardest part for getting to getting affordable health insurance for individuals is when you've got multiple family members. Okay, and just let's dive into this before I dive into more of the article. Typically, when you're on an employer-sponsored plan, in this case, it's Texas University plans, you've got an employee-only premium where the company or whatever organization you're employed by will cover some of that premium for you on the employee-only basis, and then you cover the rest. If you needed to upgrade that plan to maybe a higher tier level plan, or you just want stronger coverage, sometimes they're going to offer that opportunity to do that. They have the discretion on which carrier and insurance plans they're going to offer you, by the way. So those decisions are made, and you select from that. Where it gets tough is if there's an employee that basically is needing to add a spouse, okay, or children. So you could have employee spouse coverage. That will be an elevated premium that they have to make up the difference on. Maybe they don't have a spouse, but they've got children that need to have insurance, and that's going to be an elevated premium. So that increases that cost exposure for those employees. Let's say it's an employee family, it's the spouse and the children that they need to put on that plan. Man, that can be $1,000+ a month in that premium. I've seen it higher than that, depending on the organization. And unless you're at a pretty good or substantial income um, that you've got, whether it's through your employer or other means, that's going to be tough to take on. That's where family glitch legislation a few years ago came in to where, hey, we would analyze employee needs to stay on the company plan. And this, again, we're talking about Texas universities that stay on that plan, and we'll shop alternative options for the spouse and the children and see if that will work out. What's important to note is sometimes, you're going to have different plans. We've got scenarios where one of the family members, a spouse, will be on the company plan. Another spouse will be on a Medicare plan because they qualify for Medicare at that time. And then there could be dependent children. They're on a marketplace plan, Affordable Health Care Act plan as well, just because it made sense financially. And you're like, Justin, what man, it would be great just to have everybody all in one plan. I agree. It's just they're not affordable. Period. I've yet to see it where it is affordable on that, and I don't know if those days will ever hit. But we have to look at these scenarios where we can get creative and have affordable health insurance. Typically it's deemed affordable, and in most cases it is on an employer-sponsored plan. It's just it skyrockets when you want to add a spouse, children, one or the other, or both to the plan. So let's dive into this article a little bit. I went on a tangent there. I apologize. Annual health insurance premiums for faculty and staff vary more than $5,000 per employee across Texas universities, according to this new report from Rice University's Baker Institute for Public Policy. For PPO or POS, point of service plans, the only plan type offered at every institution in the sample, the report finds that the total annual cost of individual coverage, combining employer and employee contributions, ranges from $8,095 for Texas universities belonging to Employee Retirement System of Texas, such as the University of Houston. And it says to an amount of $15,742 at Trinity University. Okay, that's substantial. All right, and they're sounding the alarm bells over there at the universities with this report. The report, in quotes, Texas University shows sharp differences in health insurance premiums, examines plan characteristics for the 2025-26 academic year across Texas colleges and universities, enrolling at least 1,000 students. Okay. They started the article off with PPOs and POSs. I wish I had $1 every time somebody called my office, an agency, and said, Justin, I need health insurance. It's got to be a PPO. Okay. Let's take a look at it. Let's take a look at options. If the Affordable Care Act plans are going to be the way to go, because maybe they qualify for a subsidy, it's going to be an HMO or an EPO. E is in Echo, which is a hybrid of an HMO and PPO. If you kind of, for simple terms there. There are point of service plans, but there's some issues there. They still need a referral, and in most of the case, you need a primary care doctor in there. And even if you're able to do an EPO plan on the individuals, You still have to have a primary care doctor, and you typically don't need a referral for a specialist. However, most specialists are going to request that referral. EPOs, I think there was a time there where they didn't need the referrals. I mean, I'm telling you, in my situation, I had a health scare last summer, and they still need it. I'm on an EPO plan. I'm on a marketplace plan. I could do an employer-sponsored group plan if we wanted to, but I wanted to keep the costs low. And I'm on an Oscar Health plan, and I will tell you, they took good care of me last year, taking care of my wife when things have come up with her medically, it's not all bad on the individual health insurance plan. And I'm not on an HMO, but I am on an EPO that gave me some flexibility. We're here to talk about that. We're here to discuss that. If you're like, Justin, I'm still confused. Show me what options I got. We're going to be here. But most people want a PPO network because they had a PPO network through their group plan. They probably paid a fortune for it, whether they had themselves only or family members. I was with an insurance executive. It's become a good friend of mine and partner in the industry over the years. And, he was mentioning, a large group that needed to go to an HMO. The PPO plans are just not realistic anymore. Let's just say that to be affordable because you've got these companies, many companies that are helping bankroll and subsidize the health insurance costs for their valued employees because they want to, but they're having to get creative and say, hey, that PPO plan and that open network that you got, it's going away. We're going to have to offer, start out as an HMO plan as the base entry level plan to make their minimums work within the Affordable Care Act guidelines. And then you can always add a higher tier plan, but the employee will have to make up that difference. Sometimes they will. They'll say, hey, I absolutely need to have that. And listen, there are situations where you got to have a PPO. You might have a specific doctor, a specialist, a medical condition that you need that. And we'll have to help people with those scenarios where they absolutely have to have it. And we'll take a look at and analyze those solutions for you. And again, this is across everybody. I want to make sure I'm crystal clear with the audience or anybody that sees me on these online clips that I post. We will take a look and see every solution that you have. Okay. Whether you're a business trying to help out your employees with affordable options, whether you're an individual, a senior, and have access to employer sponsored coverage, we'll analyze that and compare that to the Affordable Care Act, the health insurance alternatives we have on top of that, Medicare, if you've got a dependent or yourself are coming up to Medicare eligibility, and the employer sponsored plan. All right. We pride ourselves on being able to do that analysis because it's a lot. A lot of people just stay in a lane of health insurance. And I want to stress that it's important that you are aligned with a broker or agency that cares about knowing all those aspects because we're at a point in our industry where everything is overlapping on each other. And it's more important than ever, especially with these health insurance costs increasing that we look at every solution that we've got. I mean, this is just a case in point with this Texas university showed sharp differences in health insurance premiums, $5,000 to $25,000 in cost, depending on the plan and the university and the options that they're offering. That's huge. Let's dive in a little bit more to this article. I'm probably not going to get to all my articles, but I'll try. Disparities we found across Texas universities are striking, and they matter enormously to the university budget, said Vivian Ho. James A. Baker III, that was also contributing to the Institute Chair of Health Economics, higher insurance costs for faculty and staff can translate into higher tuition for students and less money available for fund wage increases. Okay. That's a given. Okay. With what we're seeing, if the trajectory of these health insurance costs and healthcare costs isn't curbed or addressed. And I started out the show a minute ago with talking about the healthcare fraud schemes that are getting cracked down by the Department of Justice. I think that's a huge step, which can help these insurers hopefully provide more affordable options. I just don't know if it's, a little too late off of that. Time will tell. And we're going to be here to help you navigate that and address any of these updates and changes that can affect you, your family, your business, your loved ones, your neighbors, everybody out there. The report also evaluates actuarial value, a standardized measure of how much a patient's medical costs a plan covers. Um, and that's important to keep in mind off of that. I won't go into too in the weeds there. Bottom line is they're sounding their alarm bell on Texas universities having significantly higher premiums um, for the um, for the university staff and the employees within those universities. So thought I'd bring that up and address that. Common Dreams, 5 million lost in coverage. Let's talk about this article. Which one is this one? Um, Okay, this is a Common Dreams article that I came across, and hopefully I'm not boring y'all to tears out there. This is good, important stuff that I think everybody needs to know to a degree regarding what's going on in health insurance, and we're spending a lot of time focusing on that part of the insurance industry on this show. This article by Common Dreams looks like it came out June 23rd, a few days ago, by Stephen Prager. I think that's how you say that. Forgive me. More than 5 million people have lost health insurance coverage under Trump GOP law. According to a new report, the crisis is only going to get worse. Let me repeat this one more time. More than 5 million people have lost health insurance coverage under the Trump GOP law, the changes that basically got reeled back in this past fall, kicking off January 1. According to a new report, the crisis is only going to get worse. I think it will. I think we're just at the tip of the iceberg on some of the fallout, so to speak, that we're going to see with unaffordable health insurance and healthcare. Let's keep on talking about this article. Not even a year after President Donald Trump signed the largest healthcare cuts in U.S. history into law, around 5 million Americans have lost their insurance coverage, according to a report out on Monday from the Protect Our Care, which predicted that this crisis was going to get worse. I predicted it too last fall. When I first kicked off this show months ago, I think we're almost 40 episodes deep. We were talking about this. You know, we saw a storm brewing. I think that storm is still brewing. I think it hasn't really hit like what we could expect. But the massive budget and tax legislation passed by the Republicans, and again, I'm going to call out both parties. That's why I want to have both candidates for these congressional offices and slots that are coming up. I want to have both of them on the show. I want to go tit for tat and make sure we see which party is going to really address this, because I think it's a big problem that we need to get some help on. But back to this article, the massive budget and tax legislation passed by Republicans last July, known as the One Big Beautiful Bill Act, slashed nearly $1 trillion from Medicaid and the Children's Health Insurance Program over the next decade, while introducing tax breaks that are expected to hand to an additional $1 trillion to the richest 1% Americans. Now, this is a pretty um, pointed argument against the Republican legislation off of that, but I want to find the other argument to this and say, hey, this is why. The 5 million and counting, that's the human toll of that's spiraling Republican healthcare affordability crisis, said to Protect Our Care president Brad Woodhouse. Just 1 year after the Trump and congressional Republicans made the largest cuts to healthcare in history to fund tax breaks for billionaires and big corporations on Wall Street, millions have lost their care they depended on and to stay alive and healthy. I got to agree with that. I'm seeing that firsthand. I am in the trenches, probably more than I should be, seeing what's happening with these individual health insurance clients and seeing what I'm seeing with the small and large group benefits plans offerings that are being offered out there. Um, I I want to say I was hoping they would bridge the gap. I was hoping they'd extend some of the relief that the Affordable Care Act expanded subsidies did for the middle class this fall, and they didn't. And we're having to get creative and find solutions, affordable solutions for affordable health insurance for our clients. And I think we've got some good ones out there. We got to get creative out there as well, but we got a big problem, and we got to have bipartisan support on this. And I think it's the tip of the iceberg on seeing some solutions coming ahead. We're just talking about health insurance and healthcare costs. we haven't even. I wanted to go over an article on Social Security. I'm going to try to do that if I can on that storm that's coming. Okay, um, it's spending more money faster than ever, and it's like every couple months the updates on Social Security get worse, and it's getting closer and closer. I mean, it was like 2033 or 2032. We'll see these. We got a little bit of time. Now they're saying, nah, maybe we could see this issue sooner. And we're going to have to make sure our legislatures circle the wagons. We're going to have disruptions with AI. We're going through, financial inflation like we've never seen before. There's people that are really doing well, and then there's people that are really struggling. And I help out both of them. Even the people that can afford the health insurance cost and the address those higher costs because they have the means to do it, they're upset about it. They're complaining about it. And a lot of people, I think weren't expecting these changes. They were looking for some better solutions because those individuals that are at a better means income wise, they have family members, loved ones, they have employees that are getting crushed by these health insurance costs. So that's why I got this show. That's why I'm trying to bring up these important situations and scenarios, and hopefully we'll get some answers. I'm hopeful. I'm an optimist, guys, that we will these situations and these news that isn't really good news. I get to come back to you all later in the months and years to come and say, "Hey, man, remember when I was complaining to that? Boy, did we dodge a bullet there. Boy, did we turn a corner there." I'm hoping we can have that. And that's why hopefully I'll have a clip out here, and I'm going to tag some of the congressional candidates out there to join me, sit down and talk with me for a few minutes, and let's get that out to the constituents so they know they have some peace of mind there, and so people aren't blindsided. And listen, if these congressional candidates come on the show and they say, "Hey, it's just not going to look good. We're going to have to buckle up for a little while," let's let everybody know. Let's prepare. Let's get prepared. I think that'll go a long way. And again, I'm optimistic there. I think I think America's a great place. We've got some issues that need to be addressed. We got a couple fires here domestically, and affordable health insurance, Social Security is going to be one of them. And and I'm hoping we got some smart people in Washington that are going to help out with that. So let's see if we can squeeze one more article. Everybody, you're listening to the Mad Insurance Show, making a difference in insurance. I'm your host, Justin Holland from Texas State Insurance Services and Palmetto Life Group. Since I'm running out of time for the show, let's just go over a couple things. What to know about the temporary Medicare GLP-1 Bridge Program. I've talked about this a few times on the past shows, and I think it's important to bring up again. If you're taking any of these higher cost GLP-1 medications, they're starting July 1st, some Medicare beneficiaries will be able to access the GLP-1 medications by paying one flat fee per month. Okay. The temporary program is set to run for a year and a half through the end of 2027. Um, I think this is going to help. A lot of people are on these GLP-1s, are helping them. For some people, they're not. But if you don't know about this program and you're on Medicare, call us. Give us a call at 210-880-5316 or go online at txstateinsurance.com. Let's talk about this program. We'll get you some cool details on the temporary Medicare GLP-1 Bridge Program that could lower the cost of those expensive medications for you. We're talking like $50 a month copays. It's significant. And I just don't think that's getting out there as much as it should. So if you're Medicare eligible, reach out to us. We'd love to get you some information on that. Okay. Or maybe you got a family member that's Medicare eligible. It might be important for them to know. One more article we'll talk about Medicare to not cover new osteoporosis diagnosis screen testing. I don't know if that's too much of an article that I want to dive into. So I'll mothball that for next week's show, possibly. But I'm going to wrap up the show with this. This has been a busy week. I'm real excited about what we've got coming up for the next upcoming weeks and months of the show. We have some great nonprofits that we're going to highlight here in San Antonio. We've got their executives coming in to talk about those nonprofits. So, tune in, follow us online. We'd love to make sure we get that awareness out there. And we'll have some industry experts join us as well. I've had a few of them that I really like that I want to have come back. I think we didn't address everything that we wanted to. So we'll always have that. And then also, I'm going to have some congressional candidates that have said, hey, you know what? Let's talk about it. Let's get on the show. And I can bring that to you here online, and I'll bring that through the airwaves here on KTSI 550 while you're scooting around San Antonio. Texas State Insurance Services, our individual health and Medicare and employee benefits brokerage, 210-880-5316 or txstateinsurance.com. You can go to palmettolifegroup.com or call us at 877-357-5316 for your individual life insurance, long-term care insurance, Social Security analysis that we've discussed, as well as auto, home, commercial, and umbrella lines of business. We'd love to help you out with that. One more plug for our YouTube channel that I'll throw out there, youtube.com/at Mad Insurance Show. Would love for you to like and follow us there. Slowly but surely, I'm building up a following base there, and we're trying to add more clips and the full recordings of these shows as we get them to air online as well. Thank you for listening to the Mad Insurance Show. I'm your host, Justin Holland, and we'll talk to you next week, everybody. Got a great guest coming then. Take care.